Okay, so some of you are here for some of my other talks. My name is Mike Gallagher. Again, I'm a certified lifestyle educator. I've been in the nutritional industry for almost 20 years. And currently I work for Nutritional Frontiers. And my official position is wellness consultant. So I go around to different doctors' offices and other healthcare practitioners and just educate them on the latest science and research on these different nutrients. And when you combine them with proper diet, reducing stress, exercising, putting it all together, we can have some really amazing results. Okay? So I'm only here during these wellness events. Is anybody here for the first time, by the way? Is anybody here checking us out? So everybody's been here before. Okay, so great. So we have these again every 2 months. Just so you're aware, our next one will be at the end of November, weekend after Thanksgiving, 2 months away. So keep that in mind for the discounts and the specials and so forth there. But November 29th till December 6th will be our next sale. Okay? All right, so again, you can ask me any questions about anything. I'm here to, again, help you out in the back of course. But today, Doc wanted me to talk about some natural solutions for allergies, and including more serious lung issues like asthma, COPD, emphysema, bronchitis, pneumonia. Okay, so we wanted to just talk a little bit about allergies and what's happening on them, first and foremost, and then how we would take care of it supplementation-wise. Okay, so if we define allergy, it's a big problem. According to the American College of Allergy, Asthma, and Immunology, it's 50 million people have some type of allergies, 1 in 5. 1 in 5 people. Okay, so basically it's an immune reaction to something your body perceives as an invader. The body mounts a defense against the perceived invader. The defense involves all different types of reactions, which again, then you notice these type of reactions. That's what you're feeling. And of course, it affects all different parts of your body, but nose, mouth, skin, throat, stomach, and intestines are the first sign of defense, right? That's the first areas where most people notice some type of allergy issue going on. So again, it overreacts to symptoms, which is usually benign, like food, pollen, dust mites, mold. Okay, and then of course leads to all the classic signs and symptoms. So itchiness, redness, swelling, discharge, eyes, nose, wheezing, diarrhea, on and on and on and on it goes. Okay, so again, anybody, if you have allergies, of course you recognize all these symptoms. If you have a family member or a friend who has these issues, again, all these are really classic signs and symptoms going on. So here's where we get a little technical, okay? So the term allergy refers to a specific immune reaction mediated by a particular antibody, which is the protein component of our immune system called IgE, or known as immunoglobulin E. Is that loud enough? You can hear me fine? Okay. So the IgE produces what's called an immediate hypersensitivity reaction, which is what we just covered. Okay? So that causes the wheezing, the redness, the swelling in the eyes. Now, there's other antibodies, and these go by IgG, IgM, IgA. Okay? These produce more of a delayed hypersensitivity reaction. And so the biggest culprit of this is your food issues. Okay? So whenever somebody has any type of allergy, the first thing that we always start with is a food elimination program. And your top food allergies are dairy. And when we say dairy, we have to define dairy because a lot of people, don't put it all in perspective with dairy. But of course, milk, cheese, but ice cream, pizza, yogurt, commercial butter, commercial eggs, all of these things we would avoid, okay? Especially for seasonal allergies, especially for congestion and sinus issues and lung issues, especially dairy, okay? All of these are important, but if we're breaking these down, these are at the top of the list. Top of the list, dairy. So I always tell people try for 7 days. 7 days and see if you don't notice the difference. And then if you do notice the difference, stick with it for 7 more days. And then stick with it for 7 more days. Keep sticking with it. So it's one thing to tell people to stop taking dairy forever. That's a long time for people. But can you give me a week? Most people can give you a week. Okay? But you always want to make sure we spell it out for people. Because a lot of people forget about pizza is dairy. Pizza is dairy. Ice cream is dairy. Yogurt is dairy. We would want to avoid all those because those are at the top of the list. But then we get in the other ones. Gluten, the protein from wheat. Again, at least, and I was at an 8-hour seminar on gluten a couple years ago. 8 hours we talked about and looked at thousands of published studies. At least the doctor who spoke on this, he felt that at least 75% of the population is at least gluten sensitive. 75% of the population. Okay, so that's also really high at the list. Soy protein also very high on the list. Okay, other things that we would avoid: corn, peanuts, and shellfish are usually your top food allergens out there. But we always start with dairy and gluten at the top of the list, okay? Because they produce this delayed reaction going on. That makes sense to everybody? Okay? With this. All right, so here's what happens. The biochemistry behind allergies here. So the allergy involves uncontrolled formation of the IgE. The IgE travels through the blood and binds to the basophils and mast cells, which are in your immune system, which release other chemical messengers like histamine, prostaglandin, and leukotrienes. And then this is what produces that inflammatory allergic reactions. This is what causes that redness and the itchiness and the swelling, okay? So a lot of people know about that. But what is often overlooked with allergies is the association of free radical damage, known as oxidative stress. And oxidative stress is a result of this inflammatory process. So think about free radicals, right, as rust on your cells. And it affects different organ systems. So anytime you are able to use different antioxidants, they remove this oxidative stress, or they help fight this oxidative stress. And again, this is another huge component of allergies, and especially major lung issues like asthma, like COPD, like emphysema, like pneumonia. It's really a big problem with that. Okay? So for us, we have two things that would help with allergies. Okay? So that old famous TV show, I can name that tune in 3 notes. Well, we can try to really reduce a lot of our protocols to 3 or 2 things. In this case, 2 things for allergies: rad-free and Air Max. Okay? That is it. If we just do those 2 things, we have helped tremendous amount of people with all different types of seasonal allergies. Okay, so let's talk a little bit about rad-free. Okay, so I'm just going to pass this around for you if you have never seen that before. So this helps in a lot of different areas. Obviously, we're focused on allergies, but it's also great for your immune. It's great for your energy production. It's great for strengthening capillaries, your veins, especially varicose veins and spider veins and hemorrhoids. Okay? In fact, if you have those issues, we would use another formula called, along with the rad-free, called Circucare Extremities. It's an herbal tincture. And the way we do the herbal tincture, you do 2 droppers full with a glass of water or tea or iced tea or juice in the morning and also in the evening, along with the rad-free. And the rad-free we would do 2 as well in the morning and 2 in the evening. And over time, it's going to dramatically, if there's any pain involved with the varicose veins, it's going to reduce that pain almost immediately within a day. But with varicose veins and spider veins, it's actually going to strengthen that vein and reduce the size of that vein over time very significantly. And going back to hemorrhoids, right? Hemorrhoids is an inflamed vein on a very sensitive part of our body, okay? But I know for sure that if you have hemorrhoids, or you know somebody with hemorrhoids, if you just did these 2 things, rad-free and Circucare Extremities, 2 twice a day, I would almost bet money on it that it would work. How do I know? Because I've seen it time and time again. I've recommended it many times here. People have come back and said, oh my God, it worked, I can't believe it. And there was a situation last year where it was really bizarre. In the same week, I had 2 chiropractors that I was working with. Both of them told me, and I've known these guys for many years, but both of them told me that personally their hemorrhoids were so bad that they were actually considering hemorrhoid surgery. They were so bad. And I said, hold on, time out. Time out. First, well, why didn't you tell me that sooner? But that's another issue. So I just said, listen, try these 2 things. Try these 2 things. If you don't see a result in 7 days, I'll give you money back. That's how confident I was. That's how confident I was. And I've known these guys, they wouldn't even challenge me on that. So both of these guys tried it, picked it up, tried it themselves, and guess what? Both of them called me in 7 days, said, hemorrhoids are gone. Completely gone, completely pain-free. I've seen this time and time again. Okay? So that's now for varicose veins and spider veins. You did not get varicose veins overnight, right? That's a long process to get varicose veins. So you got to give us a few months with the process as well to heal those veins and strengthen those veins. Okay? But you should definitely see a difference with varicose veins within 30 days. Within 30 days. And just recently I had a doctor's office where a receptionist, she was, we were talking about this and I recommended this for her to try, and she did try this, and she actually, last time I saw her, she said, you know what? My husband has seen a difference, my children are noticed a difference, and her veins were running down her calves. They were like extended all the way down her calves. So she actually did say, you know what? This absolutely does work. It just takes time. Just takes time. Okay? So that's a big issue. We get questions on that all the time. Do you have anything for varicose veins or spider veins? Yes, we do. And that would be it. Circucare Extremities twice a day. And the rad-free, 2 in the morning, 2 in the evening. Okay? Because again, that's that free radical damage happening. Skin issues, bruising, rad-free will help with bruising as well. Nosebleeds, if you have chronic nosebleeds, that's really a capillary issue, capillary integrity as well. So this rad-free will work almost immediately for chronic nosebleeds. I've seen that as well. So again, all heart issues as well. So rad-free helps on a lot of different issues. But again, let's go back to our focus today. We're talking about allergies. Let's go back to the allergies. Okay, so what's in it? Here's what's in it. Activin, which is our grapeseed extract. In fact, it's the most researched, published, studied grapeseed extract on the market. So we'll talk about that here in a moment. Bioflavonoids, resveratrol, quercetin, glutathione is what makes it. But first and foremost, it's a grapeseed formula, is the rad-free. Again, here's how we dose it, as I said. For any major issues, intense issues, allergies, 4 a day, 2 in the morning, 2 at night. Once you start seeing the benefits and seeing the results, then we go backwards. Then we go down to 2 a day for a bottle. Then as soon as and then if you're still fine, everything's still good to go, then we go back down to 1 a day for a bottle. After that, it's your decision. You can stick with it for preventative, or you can stop taking it. But we always start high, very aggressively, attacking with the right nutrients at high amounts, and then we go backwards. Okay, that is our philosophy. Somebody said, well, I have varicose veins, can I just do 1 a day? Yeah, but it's going to take 4 times as long. 4 times as long, okay? So we want to attack it aggressively and then come down on it. Okay, so let's look at the ingredients a little more in detail here. Activin, as I said, the most published, researched grapeseed on the market. That's why we're using it. Has many different benefits, okay? Antioxidant, chemoprotective, as well as antimicrobial, anti-inflammatory. Again, there's a lot of different great studies on it. Potent free radical, helps with cellular damage, helps with lipid perioxidation, again, that oxidized process, DNA. And if we're comparing it to your vitamins, vitamin E, vitamin C, beta-carotene, vitamin A, Activin has been shown to be much, much more powerful in free radical tests. It also will enhance your vitamin C as well. So there's some added benefits to that. Other benefits, smokers. Taking Activin, taking our rat-free will inhibit the oxidative damage due to cigarette smoke and tobacco.
What product is this for allergies?
Yes, this is the rat-free. So this is the rat-free. So we're breaking down the ingredients in the rat-free, and this is the main ingredient, the Activin. So we're just breaking down the ingredients and showing you the research behind that. So if you're a smoker, absolutely we would recommend rat-free. Okay? So someone who smokes,
They need to quit.
yes, they do. That's what we would like in the ideal world, right? The ideal situation, they need the ideal situation. If you can't, this is going to at least help the situation. Nope, it's never too late.
No, I meant,
What's that?
she said they should have.
They said what?
Started.
Right, should have never started, right?
They're down the road now and they're hooked.
That's right. So anybody who smokes, this is what I recommend to anybody who smokes, is rat-free. And so I would say, listen, obviously we don't want you smoking, right? But you're obviously not there yet to quit. Can you at least meet me halfway and take something that at least is going to inhibit some of the damage that is causing to you on the cellular level, right?
Right.
So if they say, well, how much is it? And I'm like, well, it's $21. For smokers, I would do 2 a day. This is a month's supply. Now again, it's 30% off today, so that's $6 off that price, right? $14, $15. And then I always say, oh yeah, how much was that pack of cigarettes? And how many packs do you smoke a month? Right? So it costs $5, $7. You know, I had somebody say menthols, I don't smoke, but menthols $9, $10 a pack, some cigarettes, right? Crazy numbers on cigarettes, right? So it's costing you $5 to kill yourself. And I'm saying, listen, this is $20 to protect yourself. Some will, some won't, but we could try, right? That's all we can do is ask them to try on that. Another big issue is your acetaminophen, your aspirin, your NSAIDs, your Tylenols, things like this, right? Again, we talked about this yesterday for those who are here. These type of medications over time can cause liver and kidney toxicity and actually kill you, okay? In fact, more people die a year of taking acetaminophen and these type of NSAIDs than they do in the United States than they do of AIDS worldwide.
Yeah.
over 16,000 people, right? So again, we have natural solutions like we talked about for those who missed it yesterday, the X-Flame and HA Plus and so forth, right? But again, if you're happy taking your acetaminophen and you won't try anything else, can you at least meet me halfway and take something that's going to protect your liver and kidneys, and that's the rat-free. That's another way that we can position that. It's also going to help with detoxification as well, okay? Let's go back to those comparisons versus the vitamins. So at 50 milligrams, Activin has been shown to be between 84 and 98% greater than vitamin E. At 100 milligrams, Activin has been shown to be between 439 and 575% greater than vitamin C. And how many are we getting? Per 2 capsules, you're getting 120 milligrams per 2 capsules. So again, a lot of people know about those other vitamins. Not too many people know about the benefits of grapeseed. Again, so it actually is much, much stronger. Then we get into the other ingredients, bioflavonoids. Again, this is the plant pigments. This is what gives the color of your flowers and your fruits. Okay, your citrus bioflavonoids, so, you know, your lemons, your oranges, tangerines, and so forth. But these substances have very powerful antioxidant properties to them. Okay, and also anti-inflammatory and anti-carcinogenic properties to them. Okay, so oftentimes Dr. Weiner will mention bioflavonoids on a radio show. Well, bioflavonoids are in the rat-free. So those are two of the key ingredients in the rat-free, grapeseed and bioflavonoids. Here's some studies. Now, when we're looking at the allergies, so we're talking, some of you came late, we have the extra flyers up here, the presentation, but we look at all these different levels, IgE and IgG and IgM and so forth and so on. So basically a lot of the research that I'm going to show you here in the next couple slides are all showing very similar results. That bioflavonoids has reduced all of these different allergy antibodies. Okay? So, again, we listed actually the references. These are some very recent studies, 2013. And again, this is what I would show a medical doctor because this is what they want to see, is the research, because they've never seen this before, these studies. And so we have to back it up. But again, you get the drift. They're all showing very, very similar studies. Here's another study. Inhibits IgE, mast cell degeneration, decrease in allergic symptoms, also helps with airway, asthma issues as well, lowers histamine, cytokines, on and on and on and on it goes. Now, the third ingredient in the rat-free is resveratrol. And we sell resveratrol again by itself. All these ingredients you can buy by itself, but we put it together. And a lot of people are familiar with resveratrol. Again, it comes from the grapes in red wine, although you have to drink a lot of red wine to get what's in resveratrol. What that? And yeah, so the negative outweighs the positive there if you're drinking a lot of red wine. Some people don't mind it. Some people feel it though the next day. So this made a lot of news in 2006, anti-aging properties, anti-aging benefits. Again, there's some benefits with obese mice. It helps with weight loss. But again, the whole idea with this is people who consume resveratrol lived longer, had fewer signs of diabetes, better motor skills, longer lifespans, so forth and so on. Again, it's just one of a group of antioxidants that's going to help, though, with allergies. Most people have never seen the studies and research with resveratrol and allergies. So again, here's some recent studies that show, again, what we're talking about there. Inhibits IgE. Okay, here's one comparing it to this drug that helps as well. And here's another one, reducing IgE allergic reactions. Again, these IgE, for those who came late, this is what gives you those immediate hypersensitivity, the itchiness, the redness, sneezing, the wheezing, is called as the IgE. So a resveratrol will absolutely help with that. Fourth ingredient in the rat-free is quercetin. Okay? This is another very powerful anti-allergy nutrient. And it's also a very powerful anti-inflammatory. Here's a study comparing it to this drug, cromolyn, which is a mast cell stabilizer. And again, it had very similar benefits without any of the side effects as the medications. Here's a study, a Japanese study. Quercetin reduced allergic eye symptoms caused by pollen. Okay? So again, most people have never seen the research on these different nutrients. And the glutathione, this is really the king or queen master antioxidant. This will help reduce all oxidative stress. Again, it's going to help with all major allergy issues as well. Okay, so again, there's some recent data on that. And these are some of the published references that we would, again, show a doctor or somebody who wants to see the science behind that. So we listed them for you just to get an idea of what we're talking about with the references there. So you get the drift on that. So rat-free is the first piece of the puzzle, okay? The second piece of the puzzle for allergies is Air Max. So we have this in two options. We have this in a chewable, we have this in a pill, okay? This is one of the most unique supplements that I've ever seen in 20 years of doing this, because this works faster than the drugs without any side effects or drowsiness. So we compare this to Benadryl, to Allegra, okay, to Claritin, to any of those antihistamines. So this is a natural antihistamine. And the chewables work usually within 10 to 15 minutes. The pills take a little bit longer, about 30 minutes. Okay? But that's still way quicker than the medications. And they last for about 4 to 6 hours in duration. So if you are breaking out, if you have a sinus congestion issue, if you are sensitive to dogs or cat have allergies, okay? If you mow the grass and you break out every time you mow the grass, okay? If you have poison ivy or poison oak, okay? This will help. This will help, okay? And we've had dramatic results with these formulas here. So I'm going to pass that around for you if you have not seen that. We're also sampling the chewables in the back as well.
I've tried the Air Max and it works.
You like it, huh?
Good.
Yeah. Yeah, so we've had this for a little bit now. One's chewable and one's the pill. And we'll break it down here a little bit more in detail as we go. Question?
Yeah, for poison ivy, what does that do?
Yeah, so poison ivy is an allergic reaction. That's your skin having that immediate IgE reaction. So this will actually reduce that itching and the swelling. It takes the itching away, and it will actually start reducing the swelling.
Yeah, I had a case of that this summer.
Yeah.
Poison ivy on my legs and on my arms.
Yeah,
Of course, I went to the doctor. First thing he wanted to give me steroids.
sure, corticosteroids, right?
So I took this prescription and ripped it up.
Uh-huh. Yeah,
And I suffered for a while.
yeah. So I wish you had come here and asked me that question, because there was a gentleman who came here during the summer, and he had one of the worst cases of poison ivy that I've ever seen. It completely covered his arm, completely. Okay, so he came here on the first Saturday, and I told him exactly what we talked about. Rat-free, 2 in the morning, 2 at night. And the Air Max, I told him take 2, he was doing the chewables, 2 as needed, 2 as needed. He comes back the following Saturday, it's 95% gone in 7 days. And he actually wrote a testimonial on it as well.
Just the Air Max.
Air Max and the rat-free.
There's nothing like a salve that you had.
Well, we have some other things you can put topically, like the Miracle 2 lotion, or there's arnica gel might help or topically, but internally, this is going to work from the inside out. And this is what
The itch was terrible.
and I asked him, how was the itch? He said, the Air Max, and I actually had another doctor had poison ivy. The itch is gone in 15 minutes.
Okay, I'll remember that.
The itch is gone in 15 minutes, yes.
Thank you.
Yes, this works for dust allergies as well.
Just 2 a day?
2 as needed.
Oh, as needed.
Yeah, so if you're in an area where there's a lot of dust going on It lasts for about 4 to 6 hours in duration. So you just want to, just monitor that, and if it comes back on again, you want to take another dose, okay? So you just want to monitor that, but it helps with all these different issues that we're talking about as well. Yeah. Yes, the rad-free, both of these, yes. Both of these would be, but yes, the rad-free would be excellent for smokers. Yeah, yes. What's that? It's not going to help the urge, but it's going to prevent the damage that's causing this, that tobacco is going to cause on a cellular level. It damages the lung tissue, and so the rad-free is going to help inhibit some of that damage. So that's what we're doing. We're just trying to at least help do something with them long term on that, okay? Yes, the rad-free pills, correct. Right, so this is what's in the Airmax: vitamin C, quercetin, bromelain, dimethylglycine, perleseed extract, rosmarinic acid, luteolin, okay? The pills, we added some additional grapeseed extract and some N-acetylcysteine. So the pills have a couple extra ingredients in it because you can put more in a pill than you can than a chewable.
Hey, Mike.
Yes?
Glutathione, is that what's in Air Max?
No, that's what's in the rad-free. A little bit.
Yeah, okay.
A little bit, yes. Okay, so again, as I mentioned, the dosage, if you're doing the chewables, it's 2 as needed. Usually works within 15 minutes, lasts about 4 to 6 hours in duration. Or we have the pill now, the tablet. We had some requests for that. The pill one pill equals 2 chewables. It just takes a little bit longer. It takes about 30 minutes for the pill to work. Okay, and again, it lasts about 4 to 6 hours in duration. If you have more serious issues, right? The biggies, serious lung issues, asthma, COPD, emphysema, bronchitis, pneumonia, then we would be more aggressive. Then we want to do 3 servings a day of the Airmax. So if you're doing the chewables, it would be 2 breakfast, 2 lunch, 2 dinner. If you're doing the pills, the Airmax, 1, 1, and 1. Okay? The rad-free, again, would be 2 in the morning, 2 in the evening. There was another doctor's office recently whose son was on 4 different asthmatic medications. Okay? Went over this information with the doctor, picked it up for the son, and got him off dairy, told him make sure you get off dairy, okay? And within 30 days, he's off all 4 asthmatic medications in 30 days doing this. So again, I know for certainty that this will work for people if they give it a chance. Okay? It will work. Now, another real quick funny story on the Airmax. So I was doing a workshop. I did a talk for a doctor, a chiropractor, last year. And so we were, before we got started with the talk, we were doing some sampling, and I was sampling out the Airmax. And I was just explaining a little bit about it, what it does. It's a natural antihistamine, and it works like we're talking about in 15 minutes, the chewables. I was sampling it out. And there was a very skeptical lady there, very skeptical. And she was questioning me, right? And she's like, how soon? I'm like, 15 minutes. And she's like, are you sure? And I'm like, yes, I am. And she said, really? And I said, really? So she's like this, I don't know if I can take it, right? It's like the worst thing in the world for her to do is try this. Very skeptical. So then she took it, she reluctantly took it, okay? And then I started talking, giving my presentation. About 15 minutes later, she was kind of like in the middle of the room, and all of a sudden I could hear her like doing this. She go, right? Breathing very heavy. And then she just screams out, oh my God, I can breathe. I haven't been able to breathe in 3 years. I can't believe this. And then everybody started diving for the Airmax like it was a feeding frenzy of sharks attacking the Airmax. So I waited for the dust to settle, And everybody got back in their seats, and I'm like, folks, what did we learn here? And they said, what? And I said, never, ever doubt me. Never. That is the moral of the story, okay? But I've seen this time and again. It truly is one of the fastest supplements I've ever witnessed in the nutritional industry in 20 years. There is nothing that works faster than Air Max, okay? One other quick story on the Air Max. A couple wellness events. I believe it was about 3 wellness events ago. There was a woman there who came to me. She said her sinus issues were so bad that she described it as pins and needles in her face. And I asked her on a scale 1 to 10, she said it was an 8, sometimes a 9 in pain. Yeah. And then I said, and she was from Johnstown. She drove like 2 hours here. So I just said, listen, we have samples of the Air Max. Take 2 of these. Come see me in 15 minutes. Okay? You should really notice something. So it wasn't even 15 minutes. It was literally like 5 minutes. 5 minutes later, she comes over. She gave me the biggest hug ever, and she's like, oh my God, the pain is completely gone in 5 minutes. And I asked her, how long have you had this problem? She said 15 years. Helped her in 5 minutes with the Air Max. So I see this over and over and over again, folks. It's really amazing. It's one of the most amazing things I've ever witnessed. It's really unique on that. Okay, we also have something else I just want to mention briefly here too, is the X-Flame. So the X-Flame we actually promote more for pain and inflammation. We talked about that yesterday. But the X-Flame also helps with these type of issues as well. In fact, before we had Air Max, we had X-Flame. And we had some people who got some really amazing results with serious lung issues using the X-Flame because it has a lot of these ingredients in the X-Flame as well. So X-Flame not only will help you with your joint pain, it will also help you with your lung issues as well, is what I'm trying to say. It has multiple benefits. A lot of these nutrients help on multiple different levels. All right, so let's talk about the ingredients real quick here. With the Air Max, quercetin we talked about previously. The bromelain is an anti-inflammatory, helps relieve swelling, discomfort, associated with respiratory dysfunction and skin irritation. Vitamin C, most people know about, helps regulate the production of histamine, okay? Works with quercetin together to reduce histamine levels, okay? Perilla seed extract, used to support, also helps with histamine levels as well. So every one of these ingredients helps on some level, and this is really associated with a lot of these common allergy issues, the skin irritation, the redness, the sneeziness, sneezing, the stuffy nose. DMG, I talked about this at length yesterday for those who were here. Again, we could talk hours about the benefits of DMG. It's one of the most unique substances out there. When we combine it in a formula like this, it actually will help all the other nutrients make it even more efficient, more absorbable, and on its own it has anti-inflammatory properties as well to it. Okay. Rosmarinic acid and luteolin. Here's a couple published studies. Again, similar to what we talked about earlier. Lowers IgE, lowers histamine. Again, goes on and on and on and on, but you get the drift. All of these have the research to back it up on there, okay? Now, one last little point. These things will help you short term, okay? But we really want to dig a little deeper. And usually, if you have allergies, especially seasonal allergies, there's really 2 major problems that you really have long term. Either you're having GI problems or some type of GI dysfunction, okay? Or you have some type of adrenal issue. So that is really looking at the big picture and really getting to the root of the problem with these type of allergies. So again, I was at a health fair sampling out Air Max to a very large group of people, and I just did my own little survey. And out of 100 people that said they had seasonal allergies, I asked them, do you have GI problems? Almost 9 out of 10 people said they had GI problems. 9 out of 10, okay? So we can help you very easily with the GI problems. We have our GI Complete formula and a probiotic. Come see me. We can talk more about that in detail if you have GI issues. But that's really getting to the root of the problem, so you don't need to keep taking Air Max over and over and over again. That's not what we want you to do. We want to help you temporarily, short term, but long term. It's really either a GI issue or it's an adrenal issue. And if it's an adrenal issue, we can help you with our Adrenamax with that issue. So that's really looking at long term. I would also recommend making an appointment with Dr. Weiner, because Dr. Weiner does reverse allergy treatments here. So again, only he can do that here at the office, but that's another excellent way of getting rid of the allergies as well, by using his therapy and his approach as well on that, okay? So we put the brochure there together for you. So there it is in a nutshell. Again, these are the foods that we would focus on the yes side. We want to avoid the no side, but especially dairy. All dairy we would avoid with that, okay? Any other questions at all? Does that make sense? Again, if you've never tried the Air Max, please come back and help yourself. It's in the sample bowl there. It tastes like orange creamsicle chewables. Yes?
My son had like a stuffy nose.
Yeah.
For about 3 years in the winter,
Yeah.
fall and winter.
Yeah.
And he's been on antibiotics, they say sinus infections, everything.
Yeah.
It just, he always has it, even when he's done with the antibiotic. And the cough is never, he just keeps it.
Yeah.
And it's at night and it wakes him up and
Yeah.
he can't sleep, and we give him cough syrup, but nothing helps, nothing.
Right. So
I got the
The
Air
Air-
Max, but just give him 2.
how old's your son?
He's 18.
Yeah, so the Air Max, again, would help for the sinus congestion issues, also possibly the lung issue. I would also look at the Immunomax. The Immunomax is more immune enhancer, and that has 3 other patent ingredients in there as well to boost your immune. And if you're coming down with the cold or cough or the flu, we recommend a loading dose, which is 2 every 2 hours for 12 hours straight. And it should knock a cold or cough out in 12 hours or less. Yeah, so that there's some more other lingering issues going on in the immune system. So the Air Max is more for allergies and seasonal congestion, sinus allergies, and cat allergies and dog allergies and things of that sort, okay? But the Immunomax is more specific for the immune. If he keeps getting sick, that's where the Immunomax would be more specific for, okay?
But you should only give him the Air Max when his nose is stuffy.
Yeah, yes, yeah.
And get him to see Dr. Weimer then?
Mm-hmm.
Okay.
Yeah, but the Immunomax would be a little bit more specific for if he keeps getting sick.
Okay.
Okay?
Yeah.
So that's the difference on that.
Thank you so
Okay?
much.
Any other questions?
What was that, you would take 2,
2 every 2 hours for 12 hours straight.
would knock flu or the cold?
It's going to knock a cold out usually in 6 hours or less. If you have the flu, it's going to dramatically reduce the duration of the flu.
That's the Air Max.
That's the Immunomax.
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 Yes.
Can anyone take the Immunomax then?
Anyone can take it. Yeah, I always take it when I'm surrounded by a lot of people like these. I always take 1 or 2 just as a preventative. When because you're exposed to a lot of different viruses, bacteria out there, right? A lot of germs. So again, I always take 1 or 2 a day when I'm working these health events. Yes. Okay?
And on the back, there's no side effects
That's right.
on anything that they make here.
That's right. There you go. All right, folks, thanks so much for your time. Again, we made some extra copies here. If you have anybody who couldn't make it, thanks so much for your time.
Thank you very much.
Have a rest of a wonderful day, and I'll be in the back, again, answer any questions.